All right. So we want to actually establish a link between the lungs and heart failure. Okay. Establish a link between the lungs and heart failure. So of course we are trying to establish a link between the lungs and the heart. So how can chronic lung infection that's called pulmonale, all right, how can it cause heart failure in children? How can it cause heart failure in children? So for what we are having here, these are lung diseases. They can actually have issues on the heart, right? So you might agree with me, but you don't really know a clear link between them. Do you understand? So let's establish this. So chronic lung infections can usually lead to cor pulmonale. It's a serious condition where the right side of the heart fails, okay, because there's a long-standing disease condition, lung disease condition. Do you understand? So you have had a lung infection for a very long time. Do you understand? So the heart is failing because of that. But what is the link? It's still not clear, right? So in children, it is especially concerning because their cardiovascular and respiratory systems are still coming up and not as strong as ours. So it makes them very easy to actually come down with complications. So what is the cor pulmonale? It's a right ventricular enlargement and failure. It's caused by pulmonary hypertension. So there's high blood pressure, in the lungs. This is due to chronic lung disease. It's not caused by heart disease directly, but by the lungs putting pressure on the heart. Okay, so how chronic lung infections leads to heart failures in children? Chronic hypoxia. So the lung infections reduces the way oxygen is being exchanged. So low oxygen levels cause pulmonary arteries to constrict. So it leads to pressure. Okay, so the right ventricle must pump harder, leading to what? The heart muscles becoming larger, and eventually leads to a failure. Okay, we see all of this. Okay, so pulmonary hypertension too. So persistent lung inflammation and scarring. Okay, so it makes it that the lung blood vessels, they are resisting a lot. Okay, resisting blood flow. So it makes the right side of the heart that deals with deoxygenated blood, that is pushing this deoxygenated blood to the lungs, to now work harder. Okay, causing right-sided heart failure. So increased workload on the right ventricle. So the right ventricle is designed for low pressure circulation. So if there's chronic stress from lung disease, it leads to dilation. So you see that the right ventricle is actually becoming bigger. Okay. So secondary effects: the fluid backs up in the body, all right, causing swellings in the legs, liver congestion, and abdominal distension. So children may show signs like weakness, difficulties in breathing, poor growth, and a bluish skin. Okay, so that's it for the various linkages between chronic lung infections and how they can be able to cause heart failure in children.